author of Atlas of Essential Procedures, and also I've worked on good components of Procedures Console. So I trained in medical school at Baylor College of Medicine in Houston, Texas. I did my residency in the Army at Madigan Army Medical Center in Tacoma, Washington. And then since that time, I've been involved in teaching at Swedish Family Medicine, First Hill in Seattle, Washington, as faculty, and now I'm the director. Well, I really liked family medicine because it offered the full scope of things I enjoy doing. I like taking care of people of all ages. I really like doing OB and also a good number of procedural components of family medicine, which includes inpatient and outpatient procedures. So in order to actually do all that in my medical career, family medicine was the best fit for me. George Garcia and I put the Atlas of Procedures together in order to allow both medical students and family medicine residents especially to learn the core procedures of primary care. And it includes the common procedures we do in clinic. It also includes the common procedures we do in the hospital as well. So what we did is we really wanted to focus on the visual aspects of how you learn procedures. So the book itself has multiple still images of the key steps that you need to do when you're performing the particular procedure that's in there that you're reviewing. And that key step model, it helps you learn the proper order of how to do things, and also not forget key components of what needs to be done in order to do the procedure properly. And then the videos are also broken up in the same way, reflecting the key steps in order so that you can learn that process. And the goal is to watch the video and then read the text and go back again to watch the video to really fill out your knowledge base before you actually try the procedure, either on a model or on a real patient. So family medicine is moving more towards a broader scope of care, and that it's going to require family doctors to know how to take care of the patients, both in the clinic, in the hospital, on the wards, and also do more procedures that they can manage within their own clinic. And so the better trained you are in doing procedural, or having procedural training in your training years, will help prep you for your practice in the real world. So that's a key component of what we're looking for in our procedure training book, the handbook, and our videos, is to help family medicine residents to learn how to actually master these procedures in the 3 years of training that they have. One of the things I found about Elsevier is they've been extremely responsive to our ideas of how we could do better in describing and teaching procedures. And so one of the key things that happened a few years ago is we realized that the video components are really important, but some of the procedures that we do, like a lot of the OB procedures, involve things that you can't see very well because they're inside the pelvis or inside the body. And we asked Elsevier to help us get some 3D models, and so they help us purchase a large 3D model for the human body, which allows us to integrate that into our video products. And that integration actually gives you the ability to see what you could not see otherwise. And so that kind of willingness to work with the authors, give us the right tools to produce a good product, was really a great reason to work with Elsevier.